Hey, anytime Life Extension is in town, I want to take these guys to dinner. Dr. Scott Fogel is here today to talk about something, we all question: healthy prostate, healthy breasts, etc. Really important, and there are products, in addition to diet and exercise, that really help with that. I love these guys. And then healthy GI tract, Nurse Jenny is going to be here talking about that. Do antibiotics cause illness? Thank God they came on the market. But what they do is kill tiny organisms in tiny doses. Bigger organisms in bigger doses. We are a huge organism. Can they kill us or can they injure us, okay? Then I want to talk about the health benefits of garlic and then introduce many of you to a brand new Kaufman diet mayonnaise. All that and more on this Know the Cause. Today's Know the Cause is brought to you by Life Extension. Stay healthy, live better. My name is Doug Kaufman. For the past 40 years, I've dedicated my life and even my career to finding the root cause of disease. Join me in a team of physicians, pharmacists, and scientists, and soon you too will know the cause. So men finally have to worry more than women. Today's show is going to be dedicated, or this segment of today's show is going to be dedicated to breast and prostate. I own both of them, but women don't. They only own breasts, right? It's interesting that we are dying of heart disease and other cancers at a rapid pace, and yet men are most concerned about the prostate, women most concerned about breast and breast disease. So let's talk to Dr. Scott Fogel of Life Extension today about what we might want to do about that. Thank you for coming in again, Dr. Fogel. Appreciate you more than you know, because I always learn from you. Isn't that fascinating that heart disease is the #1 killer, and yet we're worried about prostate and women are worried about breast diseases? So, I mean, you were in clinical practice. You probably saw a lot of this and a lot of nail biting and so forth.
Yes, a lot of men usually see somebody else go through experiences with prostate cancer, and a lot of women see maybe somebody in their family go through experiences with breast cancer. And then that's like the wake-up call. That's when they're like, oh wait, I don't want that to happen to me. What can I do?
Well, what can I do? There's a good question, folks, because so many men are now being told, watchful waiting. Okay, I feel a nodule, right? I see your PSA is 7.5 or 10. Let's do a little conservative, watchful waiting. Hey, I'm not gonna sit around on my prostate and watchful wait. I wanna know some company is looking at this and helping us with something like this. You guys are the innovators. Life Extension, just absolutely amazing what you're doing over there. You can help put many people at ease, can't you?
Yes. And the nice thing is we can use clinical studies, because there's studies that have shown things like saw palmetto can help with BPH. There's studies now that show this interesting flower pollen can actually help with chronic prostatitis. And that's great. I mean, these are natural ingredients with studies behind them showing beneficial effects. So it's so nice. And then we like to look at all these studies and say, hey, can we put this in like one product to make it convenient for people to do? So,
and to make it cost effective. I mean, sometimes we'll go out and buy 6 products, gosh, my uncle had a prostate problem, I'm his nephew, so does that mean genetically I'm going to end up with that? It is a fear, it's a real fear for men and women, breast and prostate conditions. What about for women? We see some common threads in breast disease. For example, a study 3 years ago said alcohol tends to increase. The more alcohol, the more increased risk of breast disease, and by the by, prostate disease also. So are there natural, again, Dr. Fogel, I don't want to watchful wait. I want to be active while I'm waiting. I want to be proactive. If I can take a supplement, if I can change a diet or, do something like that, I want to do it. I want to go back to my urologist and, get the clean bill of health. Okay, your PSA is 2 and I don't feel a nodule anymore.
Well, you make a great point, Doug, is that the breast and the prostate are actually kind of similar tissues. And what you'll hear from people who have experience, they'll say, well, what's good for one is often good for the other one. So there's a lot of overlap as far as things that are beneficial. If it's beneficial for the prostate, it's probably going to be beneficial for the breast. So there's great similarities there. especially things like cruciferous vegetables.
Yeah.
They're helpful for, both. People need to eat more of those things.
Yeah. And then, Dr. Fogel, it was a rarity 50 years ago for a man to have breast cancer. You start looking at the stats today, and that's why I opened the show saying, you women only got one problem, right? We men got two problems. We have breast and a prostate. But I think women tend to be a little more fearful because they're going to doctors more. They're getting mammograms and so forth. And they're just, if I were a woman, I'd be biting my nails in there just hoping they don't see something. So what I want you guys to know is this. Life Extension is the innovative company in the supplemental business, in the supplemental world. They don't just call Brazil and put a product together and a label on it. Huge amounts of research go into this. There might be 10 different products and they choose the creme de la creme. So this is a company that is behaving responsibly and trying to help us with our diseases. If there is a nutritional component to our diseases, this is the company. They look for solutions. We tend to get very nervous about these, Dr. Fogel. I know, prostate cancer has been in my family also. I don't worry that much about it, but others do. Because I think lifestyle, proper supplements, which I feel I'm on, and proper diet has much to do with the prevention of disease. So when we get back, we'll talk a little bit more and hope to put your mind at ease about breast and prostate disease. Folks, welcome back. Thank you so much. I always enjoy it when the doctors from Life Extension come here for two reasons. I love the interview. I love to go out to lunch with them. But I learn. I learn so much. For example, Dr. Fogel and I were talking about the ingredients in some of these products that will assist you in enjoying good prostate health or good breast health. And it just blows me away how products that were in my mind so long ago are now at the forefront. This is an innovative company. This is the year I turned 68. I feel 35 years old. I told you I got out this morning and did all my exercise and I eat differently. And I've never taken a prostate formula because I don't think I had to. Never had the experiences that most men have. And yet I'm seeing if you're following the SAD, Standard American Diet, if that's the most exercise you get in the evening, right? Pushing the remote control. If you just live on canned food, then at 39.9 years old, as a male, I'm starting this product. This is a great, great product.
Yeah, that's about the age group that if men want to maintain that healthy prostate, that's the perfect time to do it. Don't wait till there's issues. Start maintaining that health of the prostate early. And in this product, we said, hey, there's so many things that have research behind them to support a healthy prostate. Can't we put them all into one and kind of make it like one thing? Because men, we're kind of notorious for not taking things well or consistently. So why not put it all in one great product? And that's what we did for this particular product.
Yeah, you tend to see, and that's this product right here, guys. You tend to see men taking, saw palmetto or men taking zinc or something like that. Both great products. But what this company has done, and it's ingenious, is figured out the components that tend to lead to a healthy prostate and mix them all together and put them in there. I don't think you're going to get men swallowing 16 pills hoping to prevent problems, but I do think you'll get men to swallow one. It's kind of a 40-year-old man's one everyday formula, right?
For prostate health,
take your
yes.
2 a day, which I still take, your multivitamin, and then add this one.
Yes.
To it every day.
You mentioned the saw palmetto. It has that in it. Has nettle root. Has lycopene. Has boron. Boron has interesting research on supporting prostate health. So a collection of herbals, minerals, all in one great product. And then the prostapollen. This is a pollen extract that, if men do have prostate issues that are a little bit more challenging, we would add that in addition to it. So most men just need the first one. If there's more issues going on with the prostate, take them both.
Okay, and once again, folks, everything that you see on the table today, these 3 bottles, are 50% off for a limited time only. So if you have a husband who has these problems, or you have a wife who has these problems, today would be the day to try it. Let me just sidebar. You will talk to a very educated, very good person who will hear you, and talk to you before you make any decisions on buying. That's why one of the 10 reasons I love your company. But these two products are kind of men's formula, right? Mm-hmm. And although men do have breast cancer problems more and more growingly, this is kind of the woman's breast formula.
Yeah. You know, one of the best things women can do is go to your farmer's market and just eat all that healthy stuff that you get from there. But you know, nowadays it's hard to do that. It's hard to eat that way all the time. So this product has a huge amount of broccoli extract. Wasabi has great health benefits, and also rosemary. Then we put in other things like some iodine in there, a small amount, because iodine is very good for breast tissue. And we put in calcium D-glucarate. Glucarate actually helps to metabolize estrogens. So this is an incredible combination, almost like you're going and getting all those healthy things and eating them every day, but it's a little bit more convenient for women.
Can you back up a little bit? You said in the male formula there's boron. I tend to think of that with bone health, but you're
also
saying
good for bone, but also good for prostate. Yes.
It's kind of interesting. See, I don't have the time, nor does the audience have the time to sit down and study all these things. That's why we rely on life extension. Dr. Fogel, thank you for coming in and continuing our education. There are natural things you can do when your fear levels are elevated about any particular problem. So we appreciate all the education we get from you. Thank you so much.
Well, thanks for having me.
You bet.
Now is the time to become a Life Extension customer. Call now and get a free 1-year subscription to the very informative Life Extension magazine, in addition to saving money on hundreds of high-quality Life Extension supplements. Call this number or go to the website and get an extra discount on the products we discussed today. And be sure to tell them that Doug sent you.
Here's Nurse Jenny Herbacek talking about the GI, gastrointestinal tract, and allergies within, right? Then I'm going to talk about something that can kind of beat up the GI tract, and that's antibiotics. Watch this.
Hi, I'm Jenny Herbacek with the Cancer Connection. I want to encourage you to take really good care of your GI tract. It supports your first line of defense against cancer and other diseases. And it will take a dedicated effort to avoid all the pesticides, chemical additives, and toxins in our present-day food supply. But it's really worth the effort because these items injure your precious gut lining. One way to determine if your tract needs some work is to identify if you have allergies. Allergies are a common indicator of gut injury, often referred to as leaky gut, and a symptom of immune suppression. For Know the Cause, I'm Jenny Herbacek.
Folks, I've spoken with you a lot about antibiotics through the years, and I try and impose my knowledge on you, as Dr. A.V. Costantini did to me in 1998. He signed this book, autographed it for me, Breast Cancer, Hope at Last. It is one of the most genius books in the world about any type of cancer. This one's breast, he has another one, prostate, and so forth. But the book is just filled with knowledge about the role of fungus on cancer. As a matter of fact, and antibiotics. He says antibiotics are cancer. So before I go to what I want to talk to you about right now, and that is that antibiotics are inducing diseases now. We've known that. Chapter 10 in his book, Breast Cancer, Hope at Last, says this: are penicillin and other antibiotics carcinogenic in humans? Can they cause cancer? Certainly doctors would not believe such a risk exists for penicillin, an antibiotic given to billions of humans. However, it is by definition a mycotoxin, and mycotoxins do cause cancer. Bernstein and Ross, Doctors Bernstein and Ross, in their study of prior medication use and health history as a risk factor for non-Hodgkin's lymphoma, a type of cancer, found that greater than or equal to 2 months of penicillin or other antibiotics were associated with increased risk of non-Hodgkin's lymphoma. And of course, this came out in the 1990s. Since, I have found documentation that now links taking too many antibiotics. We're too infected. We go to too many doctors. We're given too many antibiotics to 5 different kinds, the most common cancers: breast, colorectal, non-Hodgkin's lymphoma, lung, and prostate. I mean, it's amazing what antibiotics are doing. And just now, the medical community, and I love the way the pharmaceutical industry behaves here. Whoops, we didn't have any idea. We just thought we were killing bacteria. That was good in the 1950s and 60s, but guys, we supposedly have matured beyond that. So I want to teach you. This is interesting. Okay, this one says antibiotics, the same thing we're talking about now, and their ability to induce 5 different types of cancers, found to weaken body's ability to fight off diseases. Antibiotics weaken my immune system? I thought they built my immune system. Of course, that was the logic, folks, and medicine has changed. These aren't bad people. These are really smart people. But the times, they are a-changin', okay? I quoted this study. University of Virginia researchers have, and here's my quote, found another reason, for doctors to avoid the overuse of antibiotics. They should have done that all along. Antibiotics are fungal poisons that kill bad bacteria, but they interfere with the immune system's ability to fight off diseases. Okay, folks, here's the exciting thing. This came out of a medical journal. Your doctors might read this, and instead of handing you an antibiotic, again, double my IQ, really smart, really good people. But sometimes I feel like doctors have to prescribe. I one time sat down with a policeman and said, is it true you guys got to give a quota of tickets by the end of the month? And he said no. And I might be wrong on this. Is it true that doctors have to prescribe so many prescriptions in a month to keep their license? I mean, I don't know. I don't think it's a nefarious relationship. I just worry that they're handing out drugs like they're going out of style to those who will accept them. I'm the guy who is undoctored. I'm the guy who says I want to be fully responsible for that headache or that joint pain or whatever it is, and I want to know what induced it. So getting back to this, antibiotics can induce diseases. Now, the next graphic I think is fascinating. Wait a minute, cancer's a disease. Could antibiotic drugs induce cancer? Their frequent use of antibiotics significantly increases the risk of, and by the by, I give this slide, I teach this at every lecture I give to doctors. Antibiotics increase the risk of prostate, lung, non-Hodgkin's lymphoma, breast cancer, and colorectal cancer. It's no more guesswork, folks. The more times you go to a doctor, and in a doctor's office, you're going to get a prescription. When it isn't one of these statin drugs, then it's a blood pressure drug, and if it's not that, it's an antibiotic because, you got an infection somewhere in your body. Can we defeat infections without antibiotics? I could do a whole show on that. I've had to do that, folks. I've absolutely had to do that myself many times. Here's the take-home message. Talk to your doctor. Ask him if you can change your diet, start juicing, take natural antimicrobials instead of antibiotics. One round isn't going to hurt you. It's when it becomes a whole lot of rounds that it might hurt you.
In this day and age, we have many food choices available to us. I see so many confused patients, and even I get confused about what to eat because the playing field is constantly changing. There are so many companies that want to jump on the healthy bandwagon, but ultimately the question still stands. Is organic food preferable to non-organic? Is the high cost of these foods worth it? So here's what I tell my patients and how I live my own life. Eat as much local, seasonal, organic food as possible. The reason is simple. You get more nutrition from organic foods. In the case of protein, it boils down to the fatty acid content of the food we eat and the subsequent inflammatory response that occurs in our bodies. One very important way to decrease inflammation and to get a balanced amount of omega-3 fats, the anti-inflammatory ones, and omega-6 fats, those that increase inflammation, is by eating true organic proteins. The goal is to balance the omega-6 and the omega-3 fatty acids of our diet. A noble goal, but yet another battle we are losing in the diet wars. Stay tuned for more hints on organic versus non-organic foods. I'm Dr. Fred Pescatore for Know the Cause.
As my new best friend, you guys know what this is, right? This happens to be called garlic, and before there were pharmaceutical companies, this is what Grandma put in our socks, hung around our neck, made us eat. This is garlic, and let me just tell you quickly the problem most people have with this. This is not a clove of garlic, right? Dig into here and pull one of these little crescents out. That is a clove of garlic. Garlic tends to be a die-off product. In other words, if you're feeling miserable and you take too much garlic, you're going to feel worse for a period of time. It's killing the germs, inducing the problem. But this is on the Kaufman 1 diet. If you notice you're feeling miserable and you're making carrot juice or green juice, pull off a little clove of this, throw it in. It's always on the Kaufman diets because of its medicinal value and its high nutrition count. This is a very, very good, what we call superfood. It's called garlic. In the Kaufman diet, we sometimes make our own condiments. This recipe is going to be how we make the Kaufman Phase 1 mayonnaise. You should have an immersion blender and a tall jar. A blender or food processor will also work. Here are the ingredients that you will need to make the Kaufman Phase 1 mayonnaise. 2 organic egg yolks, 1 tablespoon of fresh lemon juice, 1/2 teaspoon dry mustard, 1 or 2 pinches of sea salt, and 1 cup of oil. Make that safflower, olive, or avocado oil. Now here are the directions to make the Kaufman Phase 1 mayonnaise. Put the organic egg yolks, fresh lemon juice, mustard, and salt into the jar. Pour in a couple of tablespoons of the oil and start to blend it. As the mixture thickens, pour in a couple of more tablespoons of the oil and blend again. Take your time, there's no hurry. Keep alternating, pouring and mixing until all the oil has been poured in and the mixture has thickened. It may take a while, but just be patient. Now, after it thickens, place the lid on the jar and leave in the refrigerator for up to a week. After that time, it should be ready to use. Just a note of caution here. This recipe contains raw egg yolks. We recommend that pregnant women, young children, and the elderly and the infirm do not consume raw eggs. You can go online and check that for more information. Folks, let me tell you a little bit about my friends with Life Extension. When you become a customer, when you buy a product from them, you become a customer. You get their monthly beautiful magazine, and as a customer, there are always perks to the company. For example, these that Dr. Fogel talked about today, the breast health, prostate health formulas, they're half off today. So it literally is so expensive, and that qualifies you then to become a customer. And as such, you'll receive this amazing magazine. You talk about a magazine with magnetic attraction. It's the Life Extension magazine. So thank you, Dr. Fogel and all the good people at Life Extension for coming in today. Jenny Herbachik, Nurse Jenny, thank you so much for our education on GI tract allergies, right? You certainly learned a little bit about garlic today. You learned a little bit about antibiotics. I'm not saying stay away from them. I'm saying use them judiciously. Thank you for being with us today. God bless you. Bye-bye.